Now let's get into the blood vessels for this area. We're going to talk about the maxillary artery, which is this one right here. This is the largest terminal branch of the external carotid artery, and it passes anteriorly deep to the neck of the mandible. It runs through the infratemporal fossa, and it terminates in the pterygopalatine fossa in the infratemporal fossa. It may lie medial or lateral to the lateral pterygoid muscle, depending on the person. And it has several parts, including the mandibular, which is the first part, pterygoid, which is the second part, and a pterygopalatine, which is the third part. Some of the branches of the maxillary artery for the first part include the deep auricular artery. This one supplies the external acoustic meatus and the outer surface of the tympanic membrane. There's also the anterior tympanic artery, which supplies the mucosa of the tympanic cavity. There's also the middle meningeal artery, which passes between two roots of the auriculotemporal nerve and enters the middle cranial fossa via the foramen spinosum. It ascends on the internal aspect of the greater wing, and it divides into the anterior and posterior branches. Then there's the accessory meningeal artery, which enters the cranial cavity via the foramen ovale and supplies the trigeminal ganglion, and it's adjacent to the dura mater. And there's also the inferior alveolar artery, which accompanies the inferior alveolar nerve, enters the mandibular canal via the mandibular foramen, and it's within the mandibular canal. This one gives branches to the lower teeth and the gingiva, and it gives off the mental artery, which exits through the mental foramen with the corresponding nerve before entering the mandibular canal. And it gives off the mylohyoid artery, which accompanies the mylohyoid nerve. In the second division of the maxillary artery, there is a masseteric artery, which passes through the mandibular notch to supply the masseter muscle. There is the deep temporal arteries, anterior and posterior. These ascend deep to the temporalis muscle to supply it. Then there is the pterygoid arteries, which supply the medial and lateral pterygoid muscles. And then there is the buccal artery, which runs anteriorly and inferiorly towards the buccinator muscles. It supplies the buccinator and the skin and the mucosa of the cheek. Lastly, for this video, we got the pterygoid plexus. This is a network of veins located in the infratemporal fossa around the lateral pterygoid muscle. This one receives the veins that correspond with the branches of the maxillary artery, and it drains posteriorly by the maxillary vein. It passes posteriorly medial to the neck of the mandible. It enters the parotid gland, and it joins the superficial temporal vein to form the retromandibular vein. This one communicates with the cavernous sinus via the emissary veins passing through various foramina, and it communicates with the inferior ophthalmic vein via the veins passing through the inferior orbital fissure, and it communicates with the facial vein via the deep facial vein.